A very good morning and welcome to Everyday Life on the Morning at NTV show. This morning we speak about the first Uganda Social Marketing Conference that will be taking place on the 12th and 13th of this month at the Imperial Royal Hotel. This is organized by the Ministry of Health in partnership with USAID and the Uganda Health Marketing Group. And so joining me in studio this morning is Duncan Keith Musumba, who is the head of marketing and communications at UHMG, and also Joy Mwine, social marketing manager, UHMG. Yeah, all right. So welcome, lady and gentlemen.
Thank you.
So Duncan, I'll begin with you. If there are viewers who didn't know what UHMG does, Uganda Health Marketing Group, what exactly is your mandate?
Thank you, Maurice, and good morning, viewers. UHMG is a non-governmental organization, and our vision is a good life for all Ugandans. So what we do is we promote health living, and under the theme of a good life, which is our platform. So we look at areas like malaria prevention, HIV prevention, family planning, and a bit of child health as well. So those are the main thematic areas that UHMG works on, and we work in different we use communication and social marketing to promote good services and health living. All
right, I'll stay with you, and so now let's discuss the Uganda Social Marketing Conference.
Yes.
What is this? Because it's the first of its kind, so clearly we need to know what you want to discuss.
Okay, so I'll maybe start a bit by talking just briefly about social marketing itself. Social marketing is a principle that started to be applied in about the 70s by Phil Kotler, one of the marketing gurus, and it's basically the use of marketing principles to sell a social good. So the way you would see Reham Collab, for example, advertising. So what we do is that we use marketing principles to promote health benefits. So for example, we will promote sleeping under a mosquito net and position it as good and as cool as you would promote as a Coke, for example. So we use marketing principles to promote that. And so the conference, what it's doing is that we're bringing together players from all over the world. We have one of the social marketing experts who's written extensively about this called Nancy R. Lee. She's already in town, and her role is to really even train Ugandans in social marketing, but also get other players in the field. We have organizations that we work with or partner with, Maristops Uganda, PACE, PSI, and different other organizations. So we get behaviors that people don't necessarily like and promote them or package them in a good way if they're going to support them in living a good life and being healthy.
All right. So Joy, this is your baby as the social marketing manager.
Yes,
I guess it's a bit difficult, and listening to Duncan, it's a bit difficult to market health issues. Because naturally health is really about managing, literally pain. So you're wondering, how do you market pain and dealing with pain and issues that concern death sometimes to the extreme? So what exactly is this we're talking about, social marketing as a tool?
Well, I think the best way to market health is to start these dialogues, such as the ones we're going to have at the conference, that lets the public know that there are many ways of preventing disease, and we need to approach it in a way of prevention other than get the disease and then start to treat it, which is what we do through social behavior change communication. So these are this is the discussion that we want to start to have, and we want all the stakeholders to really seriously push in private, in commercial, public sector, and the different implementing partners to start this discussion and say, how do we make a healthy living part of us? I mean, even if you think about it yourself, how often do you go for a full body check when you're not sick? And we're saying men who are 40 years and above need to go check their prostate so that they manage the whole process and check themselves out in order not to get prostate cancer. These are the non-communicable diseases and diseases such as those that result really from our way of living. And when we make it a way of life in terms of, sleep under a mosquito net, check regularly for malaria, go have an HIV test, these different behaviors that make our lives better. And we then save money. We then live a more comfortable life instead of spending money on treatment and things like that. So that's the approach we are trying to have, and that's the message we're trying to spread.
All right, so let's do this. I'm wondering, I mean, I'm really at pain to understand, not to understand, but to be the devil's advocate, because you know, traditionally we've known government to be the ones driving social causes to try and reduce the either prevalence of malaria or HIV and AIDS. And so now you have, you know, organizations as yours coming up to support the initiatives of government, you know, in partnership, of course, with USAID. Do we know, do we have numbers to show that, you know, if we did right, if we were to wash our hands, if we slept under mosquito net, if we were to be able to check, you know, regularly our body and pick some signs, you know, on where there might be concern, we will actually bring down the prevalence of some of these, you know, either non-communicable diseases or even the major ones. Duncan, yes.
Thank you, Maurice.
Is there numbers support you to say this is the way to go? Social marketing is the way to go.
Okay, thank you. And you bring in a very interesting perspective, because indeed we work with Ministry of Health, and we work on behalf of Ministry of Health. Ministry of Health is mainly the public sector. So as the Uganda Health Marketing Group, our mandate is to work through the private sector as well, because we know that there's a segment of the population like Maurice who will want to buy a product and would not want to use a free product. And because you attach a value to a product, then there is demand to that product, and people value what they pay for sometimes, or most of the time. So social marketing looks at that as the insight that we rally on to get people to change behavior. Because like I told you about Nancy Lee, she likes to say that when you go to the audience, go to the community, and let's make a deal with the community. Because what's happening is that if, for example, you're going to sleep without using a condom, you could take home more than you bargained for. So that deal of, you know, you could be safe here, so here's the product that I have, this is the benefit that's in there. And we've seen that when communication interventions, successful communication and marketing interventions are brought into the health sector, there's significant improvement in terms of people's lifestyles. There are people who may not even know, for example, if you start from the level of awareness, if I don't know how HIV is spread, I will definitely not know how to prevent it. So that's like the first level of, you know, do we even know? The other one is, where do I go if I need a service? Do I go to a Good Life clinic? Do I go to, where can I get these services? And the other is, what do I do in case I get a side effect? Because, you know, some of the medication could have side effects. So what social and behavior change does is that it supports the community to make the right decisions, but also provides the right information on the choices that are available. Because if you look at family planning, for example, a woman or a man should know all the choices before they decide on what they need. And that's the role of social marketing, and also the role of social and behavior change communication. And there are numbers, like UHMG, for example, reaches about 21 million people with messages. And when we are measuring effectiveness of these campaigns, one of the levels is awareness, but the other is the intention to act. So if I asked someone who's listened to an advert, and I ask, on your next if you're going to sleep, will you, or your next visit, will you consider using a mosquito net? And I said, yes, I consider it, because I heard that it does ABCD. So we measure intention, but we also have evaluations where we've seen increased uptake. UHMG distributes over 20 million protector condoms every year, and that's huge, and it supports government as well. And so for me, the issue of value exchange is the one that's really key as well in this, for people to know that they value and benefit in that product.
All right, let me come to the conference, and Joy, this is where I want to ask you, what's the target audience for the social marketing conference? Who are you looking to invite and want to be part of this?
Okay, we are inviting all our stakeholders in the health sector, public, private, civil society organizations, commercial organizations, academicians, and all health practitioners, but even the general public, those who are interested in social marketing, want to learn more, because the conference is really a platform for sharing best practice in these interventions, and also seeing how best we can distribute all these health products and services to make them more affordable, more accessible, and how we can increase demand and utilization. So anybody within that kind of audience is invited to the conference.
All right. Yeah. Duncan, and you know, listening to you, I would want to know, I mean, it's a 2-day conference, so you probably will cover quite some ground, you know, under social marketing. But what are the key areas? What do you want to pick out of this conference? What is this you want to have addressed in your first ever? Because it's more like you bring on board all the key stakeholders to do what you've been doing in the boardrooms, but now you want to open it up and bring in more people.
Yes.
So what exactly are you trying to achieve with the first one ever?
Okay, so our theme is fostering behavior change, sustainable behavior change, and sustainable health markets. And we're trying to bring all stakeholders to have some ownership into this new strategy, but then also to get to provide evidence that social marketing works, but also to provide the bigger space within which evidence on the bigger space within which social marketing plays, which is the total market, which I spoke about briefly.
Yes.
Because we have the public sector, the private sector, and the commercial. So the three, if all the three can work together, then we'll have a better health market as a country. And as you know, we depend a lot on donations, and the donor taps are beginning to dwindle. So we need to move into sustainable markets. We need to move into people need to begin to pay for health products if they can, because if you give an example of the telecom, for example, I mean, they are rarely giving out free products.
Yes,
There's
but
no
we still
freebies.
make calls.
We make calls.
Yeah, we still
My
buy
grandmother
data.
can make a call.
Yes.
She buys data. She has she's on phone. You find grandmothers now who are sending
WhatsApp.
WhatsApps.
Yes.
That's what's happening. But why is it that when it comes to health, someone will say, you know what, I need a free product for health. And yet it's very key for us. So we want to raise the profile of health as among the stakeholders that we're going to be working with. And so we see that how can we help the community appreciate health the same way we appreciate airtime, the same way we appreciate, I don't know what else, mobile money or
soft
drinks.
drinks.
Yes, soft drinks.
soft
At a
drinks.
party.
Fast food.
Fast
at a
food,
party,
yeah.
fast food. How do we make health as cool as a fast food as cool as, because what's happening is that with time, we won't have these donations coming through. And so if we grow our market to the level that they can actually begin to pay some bit of out of pocket for their health, it would be great. I'll give you an example. One day we were having a sales promotion somewhere in Barra, and we were stopped by Boda guys, and they told us, you know what, we need some free condoms. So the guy in the truck said, but you pay for where you're going to utilize that condom from. So why don't you also pay just a little bit of this, So we're trying to rally the entire community of practice, the entire community of social marketers and health providers to profile health and rethink of new strategies in terms of supporting government, because government is doing a good job in terms of the public sector. But we have people who can afford to pay, but they are getting free product. Right. So we're also trying, how do we correct that market failure there? Why would Maurice here get a free mosquito net when he can?
Doesn't make sense.
So we're trying to see how we manage market
I hear you. Joy,
yeah.
listen, there's a huge uptick in healthy living these days. You have a huge number of corporates in the gym every evening or every morning. You have a lot of people taking up healthy living products and medicines and whatever concoctions are out there in the market. People are eating right, or I think they are eating right. So I'm just wondering if they've managed to, either by discipline or by peer pressure or culture, we have picked up on this, with the corporates. How are we able to drive this whole social marketing agenda with such a group that can actually then drive your campaign without necessarily investing a lot of money in TV and radio advertising?
We've actually, it's interesting you speak about the corporates, because yes, the healthy living has grown in that kind of sector. And as you know, the middle class is growing as well. So it's a very good opportunity for us to tap into that. We have some partnerships that we have started with them, for example, with the Hashas and many such like organized groups, to really tap into what they are doing. Because when you look at a group like the Hashas, these are guys who go into the communities, do their running, have fun, but then they also interact. They do a lot of corporate social responsibility and such like. So we make sure that we come up with a program with such organizations, and as we are doing our social behavioral change communication, either through experiential with the rigs, you've seen our rigs around and all that, we kind of get in touch with them, give them this product, equip them with the information and the knowledge. So as they're doing their activities in the communities, they also pass this very important information. We also have regional offices as UHMG, where we make sure that we kind of decentralize these interventions. So whether you're in the west, in the north, in the east, we keep in touch with our Good Life clinics, make sure we organize our outreaches, and have some of these partners also be a part of what we are doing in order to spread the message. Because when you look at the disease burden, usually, I mean, lower pyramid, where the masses are, that is really a larger part of our population. So this is where someone will not visit a hospital, they will not go for antenatal, they will see the traditional birth attendant and get all these issues that come with not delivering at a health facility. So things like that are what we are trying, the message we try to spread. And when these communities look at people like the corporate guys who they really aspire to be like, they kind of really listen and tend to take up the behavior. But then we also carry some freebies, do demonstrations and things like that. So
all right,
it's really a partnership.
Duncan, picking up from Joy, you know, we have our major concerns in the communities. So you have mindset issues, whether you want to call it mindset, I don't know where to lump them, mindset, culture, or, you know, just a bringing where you have, we still have concerns with the mosquito nets. You know, there's those using them to rear animals, there's those using them for weddings, there's those using them for fishing. You still have communities that do not believe in going to health centers to give birth. So you have very active traditional birth attendants. Where is that communication? And I pick from community activities that are happening, but do we see a breakthrough in that space? Do we see change, mindset and behavioral change in those areas?
Yeah, Maurice, what's happening is you're right about the factors that affect behavior change are really huge and deep-rooted, because if it's culture issues, norms, those need to be addressed at that level. So what we've done as UHMG is we've also engaged other stakeholders. So for example, we're working with the kingdoms, you know, traditional cultural institutions because they are the custodians of you know, they're the custodians of social norms, and they're also opinion leaders. So we're working with them very closely to see that they support us in this area, in this social and behavior change communication that we're doing. But we're also working very closely with certified users at the community level. Because when I come in, for example, into a community that doesn't know about UHMG, they don't trust you. They'll trust their own person within the community. So what we're doing is that we're working very closely with people from the community to change the community, because many a times we just you'll find a scenario where people just fly into the community, want to run a few activities and then run out. Well, the community is watching, and they won't trust you that much. So we're working with community-based structures, cultural institutions, certified users, opinion leaders at the community level. You find these very powerful people at the community level that set the agenda for anything that's discussed there. If he comes for a meeting, the community will come for the meeting. If he says, let's clean our community, the community will clean. So we work with those people to try and change the social norms, build trust, and then change the community in an organic way. Because like they say, if you break the egg from outside, you end a life. But if you break it from inside, you give life. So it's the community that must buy into the agenda of changing these behaviors before we even move another step. So community buy-in is very key for our interventions, and the use of opinion leaders and people like those at the community level is also working for us to, you know, it's beginning, we see some change.
All right. Yeah. We must run this conversation to the end, and you know, I wanted to ask, given the fact that you're trying to ask people to, you know, invest some little money into their own health and, you know, themselves, we still have concerns with issues of quality. We have concerns with the issue of availability. How do we address this? Because that for me is a big issue, and I'm happy for any of you to take up this question, because it's one thing to say, guys, go out and buy a condom. You will need it to save your life. They go out, buy a mosquito net. Are you buying the right mosquito net? You know, that's where my concern is. The people might want to do it, and generally, as you build the campaign, what happens to the issues of quality? Are we concerned?
Okay. Quality, yes, we are. Quality is key for any health intervention, because if you mess up with quality, you're messing up with people's lives. And at the press conference last week, the permanent secretary was very strong on, you know, some quack doctors and fake messages that are running. As UHMG, quality is key for us, and we look at providing the good life through the provision of superior health products.
Yes.
And one of our mandates is increasing access through social marketing.
Yeah, but that doesn't stop some of these products that come from, weird places and different countries coming into the market.
Yes.
And since you're saying mosquito nets, I found a mosquito net somewhere and I bought it, but it's just not working.
Okay, that's true as well. And that's where we work with Ministry of Health and also other policy institutions that support in curbing down such such practices. National Drug Authority is one of them that helps register all drugs that are coming in. But of course, we have porous borders, so sometimes these products will come through. But I know that government is doing a good job to try and curb down this. And maybe our call to the public is to also be as vigilant as possible in terms of what we are buying, to know the quality, to also go to services that are promoted from the credible sources, for example. So Ministry of Health is working very hard with UCC, especially to curb down the advertising of fake products. So that's one of the things. But as stakeholders, we also have a big role to play.
Yes. In
terms of sensitizing the community, and also in terms of branding. For example, how can I know that this is a fake product? What are the signs that I look out for? And so that's something we're doing as
and in some of these cases, it's even it's a life threat, because if someone is having access to fake condoms, that's even worse. That's horrible. That's okay, we must conclude this. Social Marketing Conference, 12th and 13th. Do we see this happen again? Are you looking forward to driving this as an annual campaign? Are you going to make it a quarterly event? What happens next?
Yeah, we're actually looking at, this will be the first. We are looking to having such a conference annually, but we're also looking to expanding into the Africa Social Marketing Conference. So to really bring in other countries and draw best practice from the World Social Marketing Conference. So this is basically our Ugandan chapter, and we look to growing it to the Africa Social Marketing Conference.
Yes, Duncan?
Yeah, that's the whole thing. We're looking at launching the Africa Social Marketing Society.
Oh.
Because in Europe they've moved a lot in terms of, because we need to share experiences, and so we're looking at what if we brought together the entire Africa and discussed social marketing. What's happening in Ghana? I know that Ghana is one of those first countries that has run social marketing programs before we did, and has had good results. So we want to bring the local stakeholders, but also bring in the regional and Africa level. So it's something that we're going to keep running on an annual basis.
All right, you have partnerships. So you have USAID and, of course, the Ministry of Health that is driving this campaign. Do you see an agenda to increase funding into this space so that we have more messages going out there and more commitments from your partners and government on driving social media campaigns? It's a difficult thing.
Yeah. Government is committed for sure, Ministry of Health. But as Duncan said, in terms of donor, we really need to become sustainable, so as not to rely so much on them. But also these are national issues. These are also health issues. They are. You'd expect should have sustainable and continuous support, even from the donor community. I'm sure it will. I'm sure it will.
And for us, I mean, in our view, sustainability is when we have a good percentage of people that are paying out of pocket.
Yes.
In this country, 62% of our population goes to the private sector as their first stop for services, whether it's a drug shop or a small duka to buy Panadol. So if we can increase the number of people that are if we can ensure that the people that can afford to pay get the product and pay for it, and then get the free one and give it to those that need it. Yes.
Exactly. Those in need of it.
Yes. So making sure that the market is sustainable, that's how it will happen. Even if it means introducing a product as UHMG where Morris can pay, and then I subsidize for our grandmothers in the village. So we're looking at what is this product that community is willing to support, and that may not need a lot of donor intervention with time, because the market has to grow and move towards an economy where people are paying. And as we look at the, moving into middle income status, if that happens, then ideally health should also be moving into middle income status.
And the funding for the health budget must improve. All right, thank you very much. Duncan Keith Musumba, Head of Marketing and Communication, and Joy Mwine, who's the Social Marketing Manager at UHMG. Thank you for joining us this morning.